segment is sponsored by Bremo Pharmacy.
When living with diabetes, you have to pay special attention to your feet. Cary of Bremo Pharmacy offers tips to avoid serious foot complications resulting from the challenges of diabetes. It's great to have you back.
It's great to be here.
This is a special area of care for diabetics. Foot health is critical.
Yes. Yes, people who have diabetes are at risk for complications with their feet that can be very debilitating for a variety of reasons. One is that the diabetes, the high blood sugars can result in nerve damage. So they may not notice if their shoes are uncomfortable or there's a rock in their shoe until there's a blister. And then once they've got broken skin, their immune system is not as strong, so they're more likely to end up with an infection. And then sometimes it's harder to treat that infection because oftentimes there's circulation issues that make it harder for the antibiotic to get to the site. So it can really be very debilitating, but very preventable if they take the right steps.
Which is great news. I mean, the dominoes can fall very quickly, but if you are doing preventive measures, that can help. Bremo Pharmacy is a partner in this. You offer a diabetes foot care kit. So the tools of the trade of some preventative elements are all bundled together and available. You have tips for us today, Catherine.
Yes. So the first thing that I would say, it doesn't have to do with your feet at all, but someone with diabetes should definitely take their disease state seriously and control their blood sugar. And the better job they do of keeping their diabetes in check, the less likely or less risk they are of having those foot complications to begin with. So that's step one. And then step two would be good foot care prevention, starting with keeping your feet clean and dry. So washing your feet every day, making sure they're good and dry before you put your shoes and socks on, especially in between the toes. A very simple step. And then keeping your foot moisturized, make sure that your skin is soft and not going to be dry and cracking open, which can cause or be an easy way for the infection to get in.
Is that gateway for infection. And you've got a great moisturizer that's included with the kit here on the table. So looking at your feet every day, but this was interesting when I was reading ahead. Some folks may have mobility issues or flexibility issues. There's a special tool there. I'm going to pick it up. This was neat. I had not seen this before. This is included in the kit. It's a telescoping mirror. So you pull this out and it's nice and compact, but then it allows me to get a look under my feet to be able to inspect. So that's pretty critical too, included with the kit. Right,
yeah, and if you don't have the dexterity to twist your foot around and look at the bottom of your feet, it can be very helpful to use a mirror, and that's a handy tool.
Absolutely.
But yeah, the whole idea of looking at your feet, because again, if you don't have good feeling in your feet, you may not realize that there's something there that needs attention. So inspecting your feet every day, and then either seeing a podiatrist or seeing your healthcare provider if you see that something is developing that needs attention. It's very important.
Two of the other tools that were included too, keeping them, you talked about keeping them moisturized, but we have to pay attention to calluses too.
Right, if your heel is building up a callus, that over time can dry and crack open. So Pumice Stone is a nice, very gentle way to get rid of that. You do it just a little bit. Sometimes, and one of the other tips is, sometimes you need a professional to help you with that. So you go into a podiatrist to get your nails clipped, and they can file off that excess callus if it gets to be too bad. But if you stay on top of it, then that's something you can do yourself.
Fantastic. And you can take this first step, pun definitely intended, of paying attention to foot health. The earlier the better. You may be in a situation where they're already dry, they're already cracked, we've got a toenail situation, but you can start to address this and get back in good foot health shape.
Right, yeah, and then of course that last tip is getting a health professional to look at your feet. So maybe you need that podiatrist care ongoing, but if not, if you're still at the early stages, just when you go to the doctor, take off your shoes and socks. Make sure that part of your assessment is looking at your feet. and making sure.
Thanks for being back with us.
All righty, thank you.
Great thing. I'd not seen one of those telescoping mirrors before. Visit the Bremo Pharmacy, most convenient for you. The Staples Mill Road location is at the Crossroads Shopping Center. That number is 288-8361. And also in the lobby of Henrico Doctors Hospital on Skipwith Road in Suite 201. That number is 285-7730. Visit online, bremorx.com.